Hi, how are you? This video is to follow up on my parotid video that I made 5 months ago. Uh, a little background. Well, I discovered a little lump, a tiny little lump in my parotid gland. Obviously, I didn't know where it was. I just felt it in 2002, and the doctor told me it was fine. It was probably a lymph node, nod, and to forget about it. So I did, and then all of a sudden, about a year later, I hurt when I was laying down on my side, and I touched there, and I felt this ball. By the time it was probably about 1 centimeter, I let it go for some reason, and I went to the doctors a little later, and got some tests done, and the doctor ordered scans and biopsy, which hurt so much. I think I've never heard so much, and I give birth. I've never heard so much. um, so the test said that it was benign, but that they wouldn't know for sure until they took it out. So I did my research back then, and I read that my age, because of all these factors, that should probably not touch it, that it was fine, that it was not going to be cancerous or anything. So I didn't go for the surgery back then. That was probably 2003, 2004. So I was doing with it, and I would forget about it, and then hurt, try to lay down, and try to lay down on my side with my hand, and I will feel it and remember it and worry about it. So I was on and off, doing kind of like follow-ups. I did maybe 2 follow-ups on it, and it was not growing too fast, so it was good. And then I went to this doctor, which told me that this kind of tumors usually appear in older people, and that I'm so young and I have so much life to live that I'm giving the tumor a chance to turn into something that bad. So he would recommend taking it out. Uh, I just had a baby when I had this consult with this doctor. My baby was 5 months old, so I was pretty worried. I was scared of something happening to me, not being there for my baby and stuff. So I think that was one of the factors that made me rush into the surgery. I got the surgery a month later when my baby was 6 months old. I wanted to be healthy soon, to be able to play with her when she was the age she is right now. She's 1 now. So I blame myself for not doing enough research, for not asking the right questions. And when I say I blame myself, I say it because I sort of regret not knowing what was going to happen to me post surgery. What I was going to feel, how I was going to feel, what I was not going to be able to do, and how long I was going to be experiencing what I'm experiencing right now. So yeah, I did it pretty fast. I don't want to give doctor's names because the doctor was great, but that's my background. So by the end of October, about 6 months ago, I had the surgery done, and because I'm young, the doctor decided to make a smaller incision. So usually the incision goes behind the ear, goes up all the way, and then down a long way. Well, mine was not down a long way. It was only to here, okay, right here. So he had to yank it open and work his way. I'm sorry, I'm taking care of my baby right now as well. So because I was nursing my baby back then, I was not able to, or I didn't want to, take any strong medications. I was just taking over the counter, like not Tylenol, but Tylenol. And as you probably know, that's not strong enough. I was in pain, and also the doctor explained to me after I didn't know this was going to happen that he would need to and did pull one of my muscles to cover the area where he removed the gland. because otherwise it would look like I had a hole in there. What's that, Mama? Gaga. I'm sorry, I'm taking care of my baby. Um, so yeah, that hurt. I couldn't. I'm gonna continue this in a second video because my baby's eating a box. I'll be back.